I am Dr. Dhananjay Ookalkar, nephrologist, and with me is Dr. Ashwini Ookalkar, a qualified pathologist who has had vast experience in running a dialysis facility, Ashwini Kidney and Dialysis Center. She is a qualified auditor for dialysis center accreditations and has also been a member of the technical committee which has set up the standards and reviewed the standards for dialysis facilities in India. She has been the faculty for a certificate course for hemodialysis technician run by the Nagpur University, as well as a diploma course for dialysis technicians run by the Maharashtra Vocational Board. She is founder of NephLearn, India's first app for dialysis technician. Today's webinar is singularly important because you may join a dialysis facility as a technician. Your day will be full of starting and closing dialysis, washing dialysis, and making medical records. As you spend more years in this line, it would be natural for you to become first a supervisor and then later a manager of a dialysis facility. But there are very few resources available for a person who aspires to be a supervisor or a manager of a dialysis facility. And here is the opportunity. Please enjoy this webinar and have happy learning. Over to you, Dr. Ashwini.
Thank you. Thank you, Dr. Dhananjay. And as you rightly pointed out, so many technicians are qualified each year in the 1-year courses, 2-year courses. And so many then graduate just by the sheer number of years that they are there on the floor into supervisors and in charge of the unit, and then even dialysis managers. But as you rightly again pointed out, there's very little scope for their learning. And that's what we are trying to identify and address today in our webinar. If you must have been following our channel on YouTube, NephLearn, you must have seen our first podcast was with Mr. Kishore, our technician from Nagpur, who graduated from a simple new technician on the floor to now in charge of an ICU unit. And the second podcast was with Mr. Sagar, who is now in charge of 135 dialysis centers of Apollo, Chennai. And he looks after the quality assurance in all these centers. So friends, dialysis professionals which are here today, I first of all congratulate all of you for giving this 1 hour to your growth. And that is a very important investment that you have done for yourself today. The next few minutes, 40, 50 minutes, whatever it takes for us to understand this subject, even a little bit of it is going to be very important and maybe a game changer for some of you. So do follow our channel on YouTube by the name of NephLearn and look at all these podcasts. Our next podcast is going to be released very soon. And it's a very cute podcast because it's with a very senior nephrologist from Nagpur. And you will have fun because he is going to bring history alive for you. Okay. So with this, we'll start the topic for today. I thought when we start working as dialysis managers and in charge of the unit, there are a few concepts that we all have to understand and we have to address. And these skills are sometimes non-negotiable skills. So the very first part is supervision and monitoring. What exactly is supervision and monitoring? The second and very, very important part is the operational management of a floor, of a unit, of multiple units. And finally, without which I cannot speak, is the quality control in any dialysis unit. If something is done, it is not measured, it is not addressed, it is not reviewed, then there's no point in doing that. You can just get up, brush your teeth, go to sleep, eat food, go back to sleep in the night, and that's all the day is about. No, you need to plan, you need to look forward to something more, reviews, meetings, and so on and so forth. And so today it's going to be a lot of all these discussions. So what is supervision and monitoring? And what is the difference between the two? We often think of supervision when you're going for an exam, for example. You've all passed the 1-year and 2-year exams, right? So when you thought of supervision, you must have imagined the person who is sitting at the invigilator. He's sitting at the desk and you have a hot classroom with some fan on the top and you're writing your paper and he's looking who is copying and who is cheating and who is answering and is your roll number put on there, and they talk so much sometimes they disturb you while you're doing the paper. Well, is supervision that, or what is it? Let's delve deep into this topic. What supervision really is a one-to-one guidance between employees. So you have somebody performing a task, and the supervisor then goes and sees whether this task is being performed in the proper manner. So there would be some form of instructions, there would be some form of monitoring also, and some form of controlling of the employee during the task execution. Okay, this is the way to prepare the bicarbonate solution. This is not the way to prepare the bicarbonate solution. Have you filled the can completely with the 10 liters? Have you not filled it with 10 liters? And so many other points. What is the end point of supervision? It is to ensure that the organizational goals or plans and policies are adhered to. And therefore, the tasks have to be completed on time and according to the schedule. So you can't have somebody preparing dialysis solution for the whole day. No, he has just half an hour or 45 minutes or 1 hour allocated for that task. So supervision is all about this. There are some non-negotiable skills that a supervisor is supposed to have. And what are these? The very first is empathy. This is a very important skill, and we don't talk about empathy just related to the patients, but it's empathy related to each other as workers. So a co-worker who has maybe some health issues at home, has a very ill person at home that he has to take care of, or some of us are having little babies at home, especially the lady technicians, and so on and so forth. So there are so many things in which co-workers also need our empathy as a supervisor. And perhaps we can tweak our timings. We can maybe tweak our work allocation a little to make sure that the employee is kept satisfied, happy, and is motivated enough to come to work every day. The second important skill is adaptive thinking. What does this mean? It means that as and when the situations arise, you have to think out of the box. A lot of creative thinking is required over here. And there is a very good method or technique of doing this, and that is the what if scenario. By this, I mean you could discuss scenarios like, oh, what if there's no water in the unit tomorrow? What if there's no electricity in the unit tomorrow? What if nobody comes to work tomorrow morning? And there are so many other things. What if this air detector alarm goes on and off, on and off, on and off continuously? What do I do? Do I shift the patient to another machine? Or do I continue the patient and continue to press on the silence or the mute button? So adaptive thinking is a very important skill. And of course, if the supervisor himself is motivated, the whole team is motivated. If you're just coming to work because you think that a few months down the line, you're going to get a better job and you want to move out of this job, well, that's too bad, because the whole team senses that and they will definitely not be motivated enough to come to work then. The second part of your non-negotiable skills is the communication skills. When we communicate with each other, it's a lot of giving information, but it's also a lot of receiving information. So right now, even as I speak, I may be speaking in a language that you don't understand. I may be giving you information that you don't want, or you may be receiving information that you want. You're interested. That's why you're here on a Sunday morning. And therefore, giving and receiving information both are important components. At the same time, we often have new workers with us who need a lot of coaching. And as you move up the ladder, you have to coach those below the ladder to do your tasks. I've often been asked this question that, ma'am, if we teach what we know as supervisors or managers to our lower down, they will take our position. So I'm a little shaky over here. I'm a little insecure over here. But the thing is, if you teach them something that you already know, you make yourself free to learn something new and become better. So always remember, teaching someone else, coaching someone else is actually the way up the ladder for you. Because now you have taught that person how to prepare a bicarbonate solution. You no longer have to prepare the bicarbonate solution. You can go and look at reporting. You can now go and look at analysis of the data that you have gathered, and then you can impress your supervisor or your senior. And then is a very important part, that is delegation. Work allocation should form a good part of the supervisor's day, because work allocation will ensure, one, that all the tasks are completed, two, completed on time, three, completed effectively, that is what they are supposed to do is done, and fourth, efficiently, with as minimum resources as possible. And by resources, I mean manpower, I mean time, I mean actual things. Okay, so delegation is a very important component. And last is the problem solving techniques of any supervisor. We all know that patients on dialysis can have complications at any minute. And then what is the running around that we have to do? What are the skills that we have brought to the table? Are the things kept, materials that we require to address that emergency, are they kept in a position that we can easily access? Are they kept in a labeled manner? Do we get it what we want, or do we have wrong medications coming in our hand because we haven't bothered about look-alike and sound-alike, and so on and so forth. But along with the problem solving is the time management. So like I said, things have to be done on time so that there is improved efficiency and effectiveness. Decision making is also very important, because suppose, for example, you have 2 patients who land up for dialysis, but you have just 1 machine available now. So what do you do? Which patient do you take and which patient you don't? So this kind of conflict management ability is very, very important as a supervisor. Well, here's a little clipping for you to enjoy.
मुझे नहीं आता, इसको बहुत अच्छी तरह आता है। मास्टर मास्टर, तेरा नाम क्या है? पांड्या? क्या डांडिया? पांड्या पांड्या, अच्छा डांडिया। डांडिया देख, पहले तू जूता पॉलिश करना सीख। इस घर के सारे जूते लाके इसको दे दो। मुझे तेरे सारे जूते में पॉलिश करता, कमाई की एक अंदर मैं एक नाम खरीद लेता। ये लो, ये थोड़े और पुराने जूते, इनका हाथ साफ करके अच्छे से पॉलिश करना सीखो, और नहीं भी देंगे, और कुछ जूते पैरों के साथ चल के भाग गए हैं, जैसे ऑफिस आ जाएंगे वो भी देंगे। नहीं नहीं, ऐसा नहीं चलेगा। जिसको तो काम दिया उसको खुद ही करना पड़ेगा, और वो भी देर मत, लेकिन खुद के फटे के पिटाई होती है। अच्छा, ये बता, तो अपने काम करके बताओ, फटाफट ये काम खत्म करोगे तो मैं दूसरा काम दूंगा। मैं कोई बोतल निकाला भूत भूत एक बाद एक काम देते जा रहे हो। अच्छा ये बताओ, तुम दोनों में से अच्छी तरह कपड़े धोना किसको आता है? कौन? ये तो मैं कभी नहीं करूंगा। मैं बहुत अच्छी तरीके से कपड़े धोता हूँ, इसका बिल्कुल नहीं आता। मैं इसको बिल्कुल सिखाऊंगा। नहीं, कपड़े महंगे हैं, जो नहीं जानता वो धोएगा तो कपड़े फट जाएंगे। ये काम तो तुमको ही करना पड़ेगा।
So, although this is a funny clip, the message here is, what is the style of delegation? Either the person knows the tasks and so you have given the task to that person, or the person doesn't know the task and the supervisor thinks that, oh, if you don't know the task, you're supposed to now learn it on the job. So these are different styles of delegation, and we have to be careful about how and whom we delegate our tasks to. And then there are 2 types of supervision. There's a direct supervision and an indirect supervision. And let's take a look at these. So what is direct supervision? It means actually observing the person when they are doing the tasks. It will involve some form of giving instructions that, okay, you can put the tubing in this manner, you can put the new cytosort dialyzer in this manner, and so on and so forth. And that would also involve some part of training. I would like you to type out in the chat box about any situations in your hospital that you have seen where you have used direct supervision. Remember, direct supervision is about actually observing the tasks and then giving the appropriate instructions, and then accordingly also giving the training that, oh, this is not the way to do it, this is the way to do it. So there would be some SOPs and so on and so forth. So I would think this kind of supervision is useful when you have a new recruit, perhaps a new employee who has joined your unit, and therefore you need to teach him the different standard operating procedures in your unit. For example, let me give an example that there are different ways of weighing a patient when the patient comes for dialysis. One is a clear-cut, simple weighing scale, digital weighing scale that is available. A second method could be a proper handlebar provided weighing scale in which the patient can hold onto the handlebars and then climbs onto the weighing scale and is checked for his weight. Another that I have observed in some units is a wheelchair which is mounted on a weighing scale. So the patient is asked to sit on the chair and then the patient's weight is observed. So these are different ways of one simple task, that is weighing a patient before dialysis. In the same way, you can see that there are different ways in which we can do direct supervision. So if I were a new employee in such a unit, I would have to be told that, okay, this is the method of taking weight of a patient, right? The second style of supervision is an indirect supervision. And this, according to me, is the most important type of supervision. Because an indirect supervision means you're not there 24/7 or 365 days of the year. Every manager, every supervisor, every technician has days off, has some personal work, and has personal time off too. And we need to keep a work-life balance. But at the same time, we cannot delegate completely the responsibility to the person who is doing the task. That is a very important part of delegation. So how do we do the indirect supervision? We do it through information which is collected through various resources. The sources of information collection may be oral reports, somebody just calling up and reporting to you, okay, today's chlorine is so much, and shall we go ahead with the dialysis? It could be a full written report that the pH, the TDS, the chlorine, the hardness of the water, and so on and so forth is in, these are the figures for today, and shall we go ahead with the dialysis? It could be through some software that you have inbuilt in your organization. It could be a simple mail at the end of the day, number of dialysis done, number of dialysis missed, number of schedules and appointments not kept by patients, number of technicians who were absent, and so on and so forth. Okay, so these are different ways of getting indirect methods. Indirect supervision is a remote kind of supervision, and this makes information gathering all the more important. And that is why very often when you are told that, oh, you have to fill in the data, some technicians get very bored and they say, oh, what's the point of filling the data? Well, the point is that supervision is happening here. And then the supervisor gets a continuous feedback. He can give a continuous feedback that, oh, I think something's going wrong here. If you look carefully, there are so many points of supervision and monitoring in a unit. And every manager has to be aware of all of these. It may be management of the schedules, whether the patients are coming on time or not. It may be management of machine settings. It may be intra-dialysis monitoring. It may be patient assessment, whether particularly in the times of COVID, we have seen that even at the gates of the hospital, people were being monitored for or assessed for whether they have symptoms of COVID, whether they have temperatures raised, and so on and so forth. And only then were they allowed into the dialysis unit or into the hospital even. It may be reports on monitoring or reporting of water monitoring, and it may be management of machines, equipments, and staff. After supervision is done, the direct, indirect, both, you have to monitor what is the result, what are the data telling you. And this is a very famous quote, which is also very favorite of mine, that without data, you're just another person with an opinion. I feel that our unit has more infection rate. No, you don't feel that. You say, out of 10 patients, 8 patients had rigors on dialysis. And so this data points to the fact that infection control needs to be reviewed in our unit. And that's how you become a better manager. Facts, evidence, and hard facts will make sure that what you are saying is correct, technically correct, factually correct, and therefore can be acted upon. Why is this factual correction important? It's important because once you say 10 patients and 8 patients had rigors, if you implement some infection control protocols and implement them, monitor them, whether they're being implemented or not, and so on and so forth, the next time round when you collect data again and you say, out of 10, now only 2 patients have rigors, it shows an improvement. That means your management skills are working. You had 8 patients with rigors, and now you say you have just 2 patients with rigors. So therefore, monitoring, collection of data is very, very important. This monitoring can be either of processes, it may be of technical details like machine settings or machine calibrations, or maybe temperatures. It may be of financial data, that what is the number of dialysis done, what is the revenue generated, what is the loss due to breakage or pilferage or other things. And then we come to a very large section, which is the operational management. What do I mean by operational management? By operational management, I mean that there is a consideration of all the aspects of dialysis that happen in a unit. If you were to be a manager in a newly constructed unit, from tomorrow you have to cut the ribbon and start this dialysis unit, what all would you look at? Can you type in the chat box some things? So you would look at the water, you would look at the plumbing, you would look at the electrification, you would look at the beds, you would look at the machines which are being installed, you would look at the calibration of the machines, you would look at the staffing. How many dialysis are we expected to do on day one? How many staff do we have to employ? You would look at so many other things, and all that comes under operational management, whether there are supplies coming in on time, and so on and so forth. So let's take a little clip about that. It is planning of the operation that is going to help them solve this problem. So until they didn't figure this out, the coaches had decided they would keep asking them to move the bricks from one point to another point. But one of them finally figures it out, that it is the planning of the operation, that who is going to do what and how the task is going to be done more efficiently and effectively without getting tired. So this is the learning that we have from this small clip that we chose. Well, so what does management actually involve? As we had discussed, it's an element of directing. You have to direct your subordinates, the people who work with you, as to what work allocation they have been given for the day. For example, in our unit, we used to allocate work as starting, greeting the patient first. So the greeter would actually note down the consent of the patient. He would note down the pre-assessment details of the patient, and so on and so forth. The second task which we would allocate was actually priming. The third would be actually recording the data. The fourth would be actually starting and closing dialysis. And the last would be the reuse of dialysis. We have to remember that you have to be alert because it's a universal activity. There is a saying in Marathi which is "Chaufair nazar," that is, your eyes are all over the place. And you have to be, as a manager, that kind of a person. It's a continuous process. The work never stops, allocation never stops. And there's a lot of direct contact in which you are going to place yourself in. You will be interacting not only with employees, you will also be interacting with patients. And last and not the least is the utilization of the resources. Remember, we have to work efficiently and effectively with our colleagues so that the organizational goals and objectives are met. And that is how division of work is done, based on each person's skills and competencies. If the patient's skills and competencies are not commensurate with the work you are going to allocate that person, then you have to rethink. So you may have a new person who doesn't know how to prepare bicarbonate solution, but you still entrust that work to him. And what happens is that the bicarbonate solution is then prepared wrongly, and you have conductivity alarms going off all over the unit for that shift. So you have to think of what the skills and competencies of the person are before you can allocate the work to them, so that that person also can ensure a full focus on the work that he's about to do and complete it effectively. As we spoke about delegation in the earlier video clip, there is an input and there is an output, and the aim is to get the work done well through other people. Okay, so delegation is actually a very tricky process, but you have to make sure that you delegate the work according to the skills and competencies of the person so that the work is done appropriately. In delegation, one very, very important thing to remember is that the responsibility is never delegated. So for example, the CEO of the hospital is still responsible if there is a fire on the floor. It's not the individual technician or the security guard or the nurse or even the biomedical engineer who is responsible for that fire. The ultimate responsibility will still lie with the CEO. So how do we recognize how to delegate? Well, you have to recognize the person. So there are some employees who have just wait until they are told that, okay, they wait until they are told what to do. So you may have an employee who can see that a patient has come and is waiting for his dialysis. He could be greeted with a smile, but he won't do it until you tell him, oh, okay, Mr. XYZ has come at the door and of the dialysis unit. Why don't you greet him and make him comfortable? So this type of employee will have to wait until he is told what to do. The second type of delegatee is the person who asks what has to be done. He can see that there is a patient who's come for dialysis, the priming has to be done, and he has the skills to do the priming also. But yet he will withhold and he will ask the supervisor, what should I do next? And then you have to tell him clearly that this is the person who has come for dialysis. You know how to do priming. Why don't you do the priming of this person? The third type of person will be somebody who will recommend work, but not do it himself. And we all know of such people. The fourth type of person is the person who will act. He will quickly understand that new person has come for dialysis, the patient's priming needs to be done, and he will immediately take the tubing and just confirm with the supervisor once, can I start the priming of this patient? Yes, you can, and he will start priming. But at the same time, he will even advise the supervisor, why don't you do work allocation and allot machines to each person? Okay. And the last type of person is the best, who acts on his own and just reports, okay, I've done the priming of this patient, he's ready to be started on dialysis. All that data, what are we going to do with that? We are going to do quality control with this data. And if anybody can recognize what type of chart this is, can you type out in the chat box? What is this? One word for what you are seeing here. Let's see what everybody is saying. One word for what you can see on this chart. What kind of a chart is it? Okay, so we'll go on. This is a QC chart. This is a QC chart. Yes, normal chart about hemoglobin. Yes, this is a normal chart about hemoglobin. And here I have shown that there is a graph. Yes, there is a range also. This is hemoglobin, that's correct. Here you can see that there is some outliers. There is an orange line above and an orange line below. And this is known as the upper control limit and the lower control limit. And there is a dotted line showing 2 points which lie beyond the control limits. So these are outliers or special variance causes. Okay, and these have to be then investigated. So when we get data, we are supposed to look at data in this manner. And that's why Excel is my best friend. A supervisor or a dialysis manager who doesn't know Excel, well, you please rethink, go back today, look for a course on Udemy or look for a course on Google, anywhere you can find it, and do that course on Excel, because you must know Excel and you must know quality charts also. With the quality charts, when you have identified that there are outliers, then you begin the review. So these are special triggers that will tell you that something is going wrong in the unit. There are outliers, special cause variations. And then you may begin an audit. You may then do a complete review, find out what are the non-conformances, and then address these outbreaks and improvement plans. So what are the steps of a review? First of all, a team is to be appointed, or you may already have a team on the floor. Gather data. Like I said again, Excel is a must. And then use brainstorming sessions and various tools. Now I'm going to tell you about the interesting tools that we use commonly in our unit. And the first is the 5-why technique. What does the 5-why technique tell you? It tells you to ask questions. You ask the question why 5 times. Why do we have rigors in the unit? Because the patient is not taking care of the dialysis catheter. Why do he's not taking care of the dialysis catheter? Because he hasn't been trained. Why is he not being trained? Because it's not there in our protocol. Why is it not there in our protocol? Because our SOPs were written in 2000. It's now 2024. In the last 24 years, we haven't revised our SOPs. So in this manner, you carry out the 5-why technique and you will come to the root cause of why this problem has occurred. It could go another way. Why do we have rigors in our patients? Because the infection protocols are not followed. Why the infection control protocols are not followed? Because the technicians are not trained. Why are the technicians not trained? They were trained at the time of employment, but not subsequently. Why were they not trained subsequently? There's no calendar. Okay, so you go back and train them again on the protocols. Okay, so on and so forth. The second interesting one, which is Edward de Bono's copyright and trademark, is the 6 thinking hats method. These 6 thinking hats have a color. The green color is for creativity, and you can have number of ideas here. What are the possibilities, alternatives? Okay. The blue hat is for planning and action. The red hat is for, red as you know is a danger color. So you think about feelings. The yellow hat is for the potential uses. And the black hat thinking is what can go wrong? What are the difficulties? What are the dangers? Okay, can all our patients have rigors? Okay, if we start training the technicians, will they all leave the unit and go? Anything and everything works. White hats, will we get an NC from the accreditation agency? Will the corporation or the health agency come after us because we have a large number of rigors? And so on and so forth. Another interesting technique is the mind mapping, in which you can create maps like a neurological synaptic network. You think of different angles to the same problem. So the problem at the middle of this is an empathy map, in which there are different branches, whether you can think and feel something. What does empathy mean? It means seeing something. It means pain also. Some people say it means say and do. For some, empathy means hearing correctly that what the person is saying. So for some, empathy means a gain. Okay, what are the advantages and disadvantages? So a mind map could be used for thinking and brainstorming. Another very interesting technique is the fly on the wall technique. In the fly on the wall technique, imagine that you are a fly on the wall, literally, and just stand in one corner of your dialysis unit and just observe quietly, silently for half an hour. And just note down what you can see. You can hear a sound there, you can see something there, you can smell something here, you can hear loud noises, you can see the patient getting irritated, you can see a patient smiling, so many things. You can see that the technician is tired, he needs a break, he needs a coffee break, so many things. The other participants, however, are unaware of this. The persons on the floor just think you're doing your work, something, he's writing down something. The supervisor is just checking something. But actually you're observing. And your observations are actually going to help you to improve some things because you have observed them personally. And another very important technique is the time motion study. In this picture, you can see one person is sitting at the desk and doing some kind of work with a screwdriver, and some kind of repairing is going on. And there are 5 people behind him who are just writing notes. So they're only checking. He's supposed to finish this in so much time. When you were small, you must have played games like 1-minute games. In 1 minute, you have to catch hold of all the balloons possible in the room, or break as many balloons as you can, things like that. But a time motion study actually means you are going to see how much time it takes to do that particular task. For example, again, preparation of bicarbonate solution in your unit. You could actually go and check how much time it takes to gather the supplies, to actually do the process, to switch on the button, 45 minutes for the solution to be prepared, and then how much time it takes to fill all the A part and B part cans. So this kind of time motion study will help you to understand if there are any difficulties in doing the task. If you can reduce the time to do the task, for example, the supplies could be kept in the spot where the solutions are prepared. If the supplies are kept in a distant location, then that much time is added to that task. I hope I make myself clear. So let's look at one small problem here, that in this, the patients with a lower hemoglobin, that is hemoglobin less than 10 grams per DL, is increasing in a particular unit. And here's what they are doing to understand this problem and address the problem. And this is known as the fishbone diagram or the Ishikawa diagram, after the Japanese person who started this fishbone diagram. In this, we can see that man, material, machine, method, environment, and the patient. These all contribute as causes to the effect that patients with anemia is increasing. So it is also known as the cause and effect diagram. So what is the cause of man? Maybe we don't know the proper needling techniques. and there's a lot of blood loss. In materials, maybe the doses of erythropoietin and the IV iron was inadequate. Maybe some materials were changed tubing and therefore there is clotting happening. In the machines, the temperature may be higher, so there is clotting or hemolysis. In the patient themselves may be of sickle cell or thalassemia, or they may be having some kind of a stenosis or aneurysm. In the environment, the osmolality of the water may be defective, or there may be too much of chlorine in the water. And we have not been able to monitor that. And finally, the reuse techniques may be faulty, and therefore you are having either hemolysis or some other forms. And that's why the number of patients of anemia is increasing. Okay, so now let's take a look at this problem.
So guys, today I'm going to make hot chocolate. So सबसे पहले हमको चाहिए होगा दूध, तो पर मेरे को आसपास कहीं गाय दिख नहीं रही है, तो अपन फ्रिज में चेक करते हैं। ये रहा दूध, अब इसको इधर रखते हैं। नेक्स्ट हमको लगेगी एक जड़ी बूटी, तो जड़ी बूटी का लाते हैं, फिर उधर मिक्स करते हैं, चीनी डालते हैं। तो मैं इसको डाल के दिखाता हूँ आपको। ये दो भैया पियेंगे, कैसी लगी? बढ़िया चाय है।
So he started making, if you remember, and he started making hot chocolate. And these people are saying it's a lovely cup of tea. So what went wrong in between? Was it really hot chocolate that he was making? Or did he set out to make tea? Well, he himself doesn't know. The standard operating procedure says that the box, the tin named hot chocolate, has hot chocolate in it. But perhaps somebody put tea leaves in the box of hot chocolate. So that's why the fly on the wall technique or the Y5Y technique or all these techniques can be applied to this one small video. You can apply it and see just for fun that whether your techniques work. You can also apply the fishbone diagram to find out what went wrong. Man, machine, materials, methods. What do you think went wrong? Okay. So this is how we go about solving a problem using the various techniques that I have spoken about.
So guys, today
Okay, and now comes the big one. If you remember, recently we held a quiz and more than 200 people participated in that quiz, which I'm very, very happy to announce. And I'm also happy to announce the names of the winners today because they deserve that applause. The person who has come first solved it in just 5 minutes and scored the highest. And he was one of the first ones to solve that quiz. And subsequently, so many people solved the quiz, but didn't score as high as him at all. So let's take a look. But first, you have to listen to
NephLearn course Advanced Clinical Emergencies and Non-Emergencies in Dialysis है। इसमें डायलिसिस से जुड़ी कॉम्प्लिकेशंस को डिटेल में समझाया गया है, जो सीनियर टेक्नीशियंस, आरएमओस और डॉक्टर्स के नॉलेज को एनहांस करेगा। पूरा ट्रस्ट द्वारा 1200 रुपए का डिस्काउंट सिर्फ पहले 200 डायलिसिस प्रोफेशनल्स के लिए है। इस कोर्स को 1499 के बदले आप इस स्पेशल ऑफर से सिर्फ 299 में खरीद सकते हैं। तो आज ही खरीदिए इस कोर्स को और अधिक जानकारी के लिए NephLearn ऐप को डाउनलोड कीजिए प्ले स्टोर से।
Okay, so who are the big winners? Mr. Vishwa is number 1, Kirtana is second, and Priya is third. And each of these winners, as we had promised, have got a special copy, a PDF copy of the Handbook for Dialysis Technicians. Friends, if you want a copy of the Handbook of Dialysis Technicians, you can also participate in this quiz. It's still live, and anyone who scores above 20 on 26 is eligible to get this prize. And I'm sure some of you who are preparing for various exams would really want a copy of this book. It has been written by Dr. V.L. Gupta, and he's the editor-in-chief, and many other authors who are prominent nephrologists of Nagpur. So this book is a limited edition book, and there's only PDF copies available now. I'm proud to say that this book has been used by PGI Chandigarh for their students' education, and that was a very big honor for us in Nagpur. This book will be made available to you if you solve the quiz. And what I wanted to say is that the next podcast, which is coming up in the next week, is with Dr. V.L. Gupta, and you will understand and enjoy the podcast when you see the book and see him also. Thank you.
NephLearn का नया कोर्स एडवांस्ड क्लिनिकल इमरजेंसीज एंड नॉन इमरजेंसीज इन डायलिसिस है। इसमें डायलिसिस से जुड़ी कॉम्प्लिकेशंस को डिटेल में समझाया गया है, जो सीनियर टेक्नीशियंस, आरएमओस और डॉक्टर्स के नॉलेज को एनहांस करेगा। कोरेप ट्रस्ट द्वारा 1200 रुपए का डिस्काउंट सिर्फ पहले 200 डायलिसिस प्रोफेशनल्स के लिए है। इस कोर्स को 1499 के बदले आप इस स्पेशल ऑफर से सिर्फ 299 में खरीद सकते हैं। तो आज ही खरीदिए इस कोर्स को और अधिक जानकारी के लिए नेफलर्न ऐप को डाउनलोड कीजिए प्ले स्टोर से।